Oh, thank you. I'm humbled to be here. My doctorate is in business, so if I'm a little light on the technical side, please bear with me. I've been in diagnostics now for over 35 years, and my specialty is taking new medical technologies to market. 5 times I've worked from a startup situation and brought it in and made it part of a major company like Merck. We are called the Merck Global Health Initiative, and we're part of Merck out of Germany. There's not to be confused with Merck Sharp and Dohme in America. Used to be one, but at the end of Versailles, the Americans didn't take any territories as a reward for the war, so they took the pharmaceutical company. We're divided into 3 parts: healthcare, life sciences with MilliporeSigma, which I came from recently, and performance materials. And we're a very old company. We were founded in 1668. Right now we're well over $14 billion a year in sales. We have a huge presence in Africa. We've been adding people. Our challenge a few years ago was that top management didn't have African experience. And over the last 2 years, we've taken our board of directors and all of our senior managements and put them through tours throughout Africa. We call it our GL presentations. I've participated in Johannesburg, in Abidjan, and in Abuja myself. Our goal is healthy families, healthy communities, healthy economies. And access to medicine happens to be one of the pillars of our company. And another pillar of our company is dedication to children. So medicine and children go together, and that's our focus. So we don't want any children without a health solution. And we're hoping to deliver life-changing solutions from our different competencies, from all those different divisions that you saw there. We want to concentrate on children and mothers in developing countries. We're focused on major infectious diseases. Right now, we have financed programs in schistosomiasis and malaria, and we're close to doing one for women's health. We have a lot of strong external partnerships that I'll get into, both academic and industry, and we welcome participation. I was here over 2 years ago, I think it was, and I presented, and I was pleasantly surprised because, like this one, I always reach out to researchers and to entrepreneurs, and I ask them, if you have an idea and you need help bringing it to market, at least have a conversation with me. I can't take on every project. I have a limited budget. A lot of times I go outside my company for help, much like you. I do Gates and I do other people, and we see what we can get. But the purpose of my discussion here is to show you what we've done and to implore you to help. So our primary focus is Africa. This is an example of some of the partnerships we've had. I've worked personally developing a platform for an instrument called the Muse that you'll see. We spent several years in Africa at the University of Yaoundé testing it and making sure that it would function properly in the African environment. I primarily have worked mostly in Western Africa, but I've been all over the place there with different projects. Our operating model is called a social business, okay? Everybody's gonna go, okay, where is he coming from? Outer space here? We do wanna make a profit, but only a profit to sustain the business and to sustain the research. We're not pulled away from profit from senior Merck or from the Merck family. In fact, the Merck family helps subsidize some of this. We're very much into philanthropy, but we're not a non-for-profit. We have to pay our employees, and that's what we do. We don't want to lose money, but on the other hand, we're not going to gouge the customer. Most of the tests that I put out there are under 2 pounds a test, so in cost. So we've been very, very cost effective on what we've sent to the market. So I'm part of the Merck Global Health Unit. I'm head of diagnostics. Basically, we're looking for impact and sustainability. We have 4 sections: a detection section, that's pretty much what I head up, diagnostics. We have a transmission section, a treatment section, and a healthcare section. I should have come right after you. It would have been a great segue. I don't have to talk about the social impact of schistosomiasis. This lady has done a wonderful job. But this is one of our primary focuses. We just had a meeting last week with the University of Leiden, and we are contracting with them to, right now, immediately qualify their antibodies and to make sure that they'll work on diagnostic platforms. And we also introduced to them a new diagnostic platform that employs shark antibodies on a filter paper. And we think that it might be the cheapest way to do point-of-care testing. So once again, there's so many divisions at Merck, and it's hard to have a hunting license to find out what the technologies are available in my own company, but I work on that too. We were part of the London Declaration on Neglected Tropical Diseases. We're an active participant in this wonderful international society for neglected tropical diseases. We have the PZQ donation. I don't know if you realized, but we have given away close to 15 million euros in free donations year to date. So we had a big ceremony in Abidjan in Ivory Coast last year. We gave away our millionth tablet there. So we also have a quality initiative finding fakes in pharma, and we put out free mini labs in most of the countries. I went to Luanda and saw it in action there, and they actually caught somebody with a bogus product. We want to eliminate schistosomiasis, so we're part of the resolution. I think it's a challenge. I don't know if we'll meet the deadlines. I think the infections are more ample than what we're taking on, but everybody's committed. So this is our One Merck for schistosomiasis, developing an assay for detection. On my end, on the diagnostics, we're looking at the Muse platform, working with Leiden and an antibody using a bead test. Right now, we're just qualifying the antibody. It's early in the process with schistosomiasis. We did receive aid from the Gates Foundation to get the project initiated. Treatment, of course, you know about the PZQ consortium. We have never sold any PZQ up till now. It's all been given away, but we are developing a new pediatric formulation, and we don't think we can be able to give it away. It's too much money in the development. We work on transmission through Merck Chemicals, and we work on education through the healthcare systems. This pretty lady is Dr. Balin, and she's our CEO. Another area that we've worked on is malaria. I'm not going to go into all the statistics. You guys know how common it is. But there's a lot of funding going on for malaria control. The populations are at risk. We're working on malaria with the Muse platform, and I'll tell you about the Muse platform in a little bit. So this is the One Merck for malaria strategy. We have the 2 malaria assays in development on the Muse platform. One is a screening assay that'll phenotype whether it's Vivax or Falciparum. The other assay is a parasitemia level, and it gives you the number of parasites per microliter of blood. Both of these are going into field testing. We've signed an agreement with the University of Lagos. We plan to bring initial field testing in June. Beforehand, we've been testing in our own lab with frozen samples, and everything's a go so far. Transmission, a lot of people don't realize that Merck makes the only DEET-free, what do they call it? Yes, thank you. That prevents, you can spray it on, insecticide, and it's completely safe for mothers and children. We're selling it to other vendors in bulk, and they're beginning to get it out. It's a very new product, and it's very successful. Inside, our accountants call it IR 3535. Treatment, we have numerous formulations, 3 that I know of, that are in stage 1, and there's plenty of money being invested there, and we hope to have it well. We're also developing learning apps for the healthcare systems. You've got malaria, this is how you'll treat it, this is how we diagnose it, that type of thing. This is what you can do. So this is what we're doing initially for the developing world. This is the Muse platform. I was one of the developers of the Muse. It weighs about 4 kilos, and it's portable. It uses electricity but can be run on batteries. Right now we have it out for CD4 testing. It is the most sensitive and specific CD4 test available on the market today. We kind of have a very easy interface. I tell everybody, if you buy a Muse, it's extremely easy to operate. If you can pipette and operate a push-button screen, you're there. We have all sorts of great software for reporting. It's got 7, I think, UPS ports, so you can hook up anything to it or interface it how you'd like. The way it works is you do a preparation of the sample. It's usually a 1 or 2 or 3-step assay. You put the tube in the container, you push it up, and it aspirates into a capillary, through a capillary. There's a flow cytometer there. It's basically a green laser with 2-color fluorescence. And we do up to 12 measurements on any cell that comes through with multiplexing. The beauty of the system is the sample is measured, the cells are counted, and the math works backwards and forwards. And our sensitivity on low counts is unmatched. So it's a very good system. The reason we have such great sensitivity on the low counts is a patent that we've got. With flow cytometer, if you have the culminating lens far away from the point of interrogation where the cells are counted, it's like a magnifying glass. If you pull it away, you might get more of the interior structure of the cell. But if we're just counting cells at very low levels, we don't need that. We want a resolution for counting. And our patent is that we mount the lens right on the capillary itself. And so we get an excellent counting resolution. In my preclinical trials at the University of Yaoundé with CD4, we were able to replicate CD4 counts down to 5 cells without any manual gating. We won numerous awards for this product because the whole flow cell fits in a Coke can. So designed for sub-Saharan Africa, in talks with the Gates Foundation and with WHO, one of the increasing segments, the fastest growing segment in Africa, is ambulatory care laboratories. These are laboratories that are mounted on vans or buses or all-terrain vehicles, and they actually go into the village. And the idea is to take an instrument and put multiple tests on it. So you may have a women's health day on Monday, Tuesday you might have a parasite day, Wednesday may be malaria. They can fit very few number of instruments onto these vans, so having an instrument with multitasks would be a big benefit. And so that's where we're trying to go with the Muse technology. We have a huge scientific advisory board for just about every test we make. This is my one for CD4 testing. And it was the first diagnostic test on the Muse. We do adults and pediatrics. The beauty of it is finger sticking, and it only uses 10 microliters sample. And on every report, you get a CD4 total count and a CD4 percentage count. And again, with the sensitivity on the low end, we can see a recovery of T cells better than just about any other technology out there. And these are some of our studies that we've done, both in Yaoundé and in UCSF, but you can see that our linearity is very good, our sensitivity and specificity is there. And the nice thing about it is we have very, very tight CVs, the tightest in the flow cytometry market. Our counting technology is just very, very good. So here's my plea: if you have a neglected tropical disease that you're working on, and you're interested in our platforms or in working with us, contact me. It takes me a while to do budgets. I do my budget submissions in August, and I get my budget in February. So just letting you know. We keep our prices as low as possible. Our cost per test on CD4 is the lowest on the market. We don't have a lot of waste. Every one of our disposable products can be decontaminated. The Muse only generates less than an ounce of waste in a full week's work, so it's not much to decontaminate and go. There's a decontamination chemical on board the system, and so once you pour the waste down, it's already decontaminated off the Muse. And we're starting the malaria. As I said, there's two tests out there. We can tell you if it's falciparum versus Vivax, and we can give you the parasitemia level measured in parasites per microliter or the percentage of red blood cells infected. And we have an expanding scientific advisory board for malaria. Not on this list, but having joined us is the people at the CDC. They're helping us with frozen samples. And it's a bead technology. Basically, we can load up to 6 beads on it. It's 2-color fluorescence, so we can get up to 12 analytes on any measurement. The top part here is HRP2, LDH, and this is how we separate the falciparum from the Vivax. Everything that we've tested so far has worked, so the system hasn't been stumped yet. And these are examples of, early examples actually, of parasitemia level. I'm sorry I don't have data on sensitivity and specificity yet, but it's coming. Schistosomiasis is a complex life cycle. The transmission of eggs happens so fast and the species multiplies so fast. I don't know if we're ever going to completely eradicate it, but we certainly can bring it down. And we're willing to work with anybody on schisto. As I said, we're just getting started. And that's the Merck Global Health Institute. Any questions? Well, thank you for your time, especially being the last one on the last day. I'm seeing some smiles. That's good. Take care.